The floor is yours.
Thank you very much. Hi, everyone. Wanted to give you a bit of an update regarding Omicron and just give a bit of an media briefing on some of the new developments. I'm going to concentrate more on Omicron today and give you a brief update on that. Just before I start, I just want to tell you that we are going to restart regular media briefings as of next week. I think that we took a small break. We had a lot of other issues we needed to do with our staff and get the clinics going, but there's a lot going on. The public appreciated the weekly updates. I know the media did as well. So we are going to restart them as of next week on a weekly basis. We're just trying to land on a date, find a spot between my staff coming back from the weekends and gathering all the information. So we want to do it earlier on in the week, trying to respect a lot of your deadlines. And so stay tuned. You will get a media briefing invite on a weekly basis again, starting next week. So I'm just going to share very quickly to give you a bit of an update now of where we are locally and provincially with our numbers. And again, I'm going to go quite quickly through it. Today, we increased by 784 the cases in Ontario. As you know, they were up to 900, over the 900 over the weekend. However, again, most of them are around the northern parts of Ontario. And what we're actually seeing is most are in non-vaccinated individuals. And, the higher the percentage of vaccinated decreases as you get into the hospitals. Again, deaths are quite low. Again, hospitalizations are really flat, both in terms of ICU and regular admissions. And even in our area, you'll notice that we have actually no hospitalizations from our area. We have 2 in the hospital from Akwesasne, but from the remainder, there's none. And that's a stark contrast to what we had many weeks ago. Again, what we're seeing provincially is an increase in positivity cases, actually 7-day rates particularly among the non-vaccinated. Here is still a big difference between non-vaccinated and vaccinated here in the lower corner. Talk about locally, we added actually 45 cases this weekend, and I know it looks high. I can tell you that most of the cases are driven by one outbreak that we have in a manufacturer that has over 32 cases. We've had the 34, actually we have a smaller outbreak elsewhere, so it's a total of 34 related working at those areas, most of which again are not vaccinated, and the remainder of the cases are related to these cases, household contacts, small children, and so on. And I'll give you a bit of details as we go down in that regard. We went upwards. Again, that's again due to the outbreak that we've had, stable in the remainder of our area. Again, about 29% are not vaccinated, and about 71% are not vaccinated. So again, the majority of those cases. I want to tell you that from the 45 cases that we added, 16 are under the age of 18. As a matter of fact, 14 are 0 to 17, and we have some younger babies among that. Again, most of them are household contacts from non-vaccinated older individuals. Our positivity rate, again, is kind of hovering downwards, but still not where it was many weeks ago. So it's going up and down, up and down. It is a bit up in the Cornwall and SDNG area, reflecting our outbreaks. But again, overall, we're not seeing a big increase. Schools, again, we're having, again, most of them are home exposures outside of the school. Most of them are cases in schools are among the non-vaccinated. I've shown this before in terms of the waning, and I'll talk about third doses. I also want to just give you a bit of an update now on the way we'll be reporting our data. First of all, the ministry is going to be switching very shortly from our population base, which was based on Ministry of Finance projections, That's going to be replaced, and it's actually starting to be replaced by Stats Canada 2020 projections, which in our situation are in some populations it's a bit up, it's a bit lower than what we had, a bit higher in others. Overall, it's a 3% increase in our total population, and so you will find some differences, particularly among when I show you the next graph. But now what we're doing is all of a sudden we're looking at sort of smaller percentages of people vaccinated, but that's because now we've added to our denominator about almost 16,000 children 5 to 11 years of age. So, and we haven't vaccinated that many, and we've only vaccinated almost 500 between last week and as of last week. We're vaccinating more as of today, obviously, but that's going to go up. So that represents about 3% or so of what we vaccinated. And but I can tell you that so our numbers have gone down because now they're including a 5+ population. So with our current numbers of 169,000 first doses and 162,000 second doses, we're at basically we've given 82% of our currently eligible population, which is 5 and above, doses. And the reason it went down is because we virtually have not, vaccinated significantly the 5 to 11-year-olds, and now we're about 80%. I'd like to see that number here, in the high 80s, because it really reflects a significant proportion of the population once we add the 5 to 11s to that. But again, so it's not that there's an error, it's just that we're now basing it on a larger denominator. And of course, as we vaccinate more children, this number is going to go up. Again, based on what I was telling you before, again, these numbers here in terms of age groups, percentage of age groups are slightly different than what we had a couple of days ago, because the denominator has changed. As some of you may recall, we were quite high, and I was always wondering why we were so high in the 30 to 39-year-olds. I mean, I was happy, but we were over 90%, and now it's been adjusted because it was a bit less. That was one of the statistics that went down a bit in terms of population, and so that went up. And so the percentage went down. Similarly, among 12 to 17-year-olds, we were at around 84%. But again, there was an increase in the denominator, and so that's why we're now about 81% or so. The remainder is kind of stable across the board here. So, like I said, there was 3% overall, with some a bit more, some a bit less of ups and downs. And here you can see that with almost the 500 we vaccinated, we're about 3% of the 5 to 11. So this will start going up as we ramp up our vaccines. We have basically at this point, we have 6,500 positions available between now and the end of December. More than half are already taken, I would say, and that excludes school clinics moving forward. Just a quick rundown here for the next one is just again to show you that the majority of cases in terms of deaths and so on are among unvaccinated. And this is Public Health Ontario data. This was the previous one was Canadian data. This is Public Health Ontario data. Again, showing you differences here. I've shown this before. So I just want to go to sort of our some of the things that I want to talk about right now, which are really, pediatric vaccine. And I've spoken to you about it before. Tonight, I'm giving a town hall with Jim McDonnell for the and Wednesday for Prescott Russell with Francis Drouin. And so I think that I just wanted to summarize that. We just added a nice video on our website, among other resources that we have, which, for parents and so on how to hold your child during immunization. I went to 3 of our clinics over the weekend, one on Friday, 2 on Saturday, and I can tell you that it went very well. The children were quite, there wasn't no issues, very smoothly. So I hope that we can continue doing it smoothly, and parents can continue to come to those clinics. We're trying to make them as kids friendly as possible. We're also going to be tonight I'm going to have a local pediatrician, Dr. Enchma, who will actually talk about her she's volunteered to help us vaccinate children who may be intimidated in big settings, an appointment in her office in Cornwall for the Cornwall and SDNG area for those kids, but more details to come. So now what I just want to really focus on really is what we're seeing now, what you've heard since Friday, the Omicron, which is basically the new variant that was found, and there's not much now, like the transmissibility, not yet clear. It seems it may be more infectious, but it was done in a population where the majority were not vaccinated. 25% of people in South Africa are vaccinated. So it's different. It's very difficult to assess the real infectious ability of this. Severity of disease, not yet clear. We've had some indication that it's been mild illness. Effectiveness of vaccines, again, we're not sure. There are many mutations in this, and I just want to tell you that for people out there, mutations, the virus has changed. It's natural, it's normal for these things to do. But what happens is we know that when viruses thrive in bodies, and the more bodies they thrive in, the more chances they have to mutate. And so it's not surprising that we're seeing mutations, and they're now called, variants of concern. And the mutations change the way that it could potentially infect others, the severity of infection, whether or not it responds to vaccine. So that's why we are concerned about it. But at this point, we don't have any clear evidence. So we're going to be waiting for some of these studies to be done over the next couple of weeks as to how easily it's transmitted to people, how severe disease it gives. Do vaccines work against it? And again, in the interim, because we want to be safe, so it's rather to be safe than sorry, we are taking measures in Canada, restricting flights, quarantine testing, returning Canadians, enhanced surveillance and contact tracing. As you've heard, there is restriction of flights from 8 countries in the African area. People coming back, Canadians returning have to be quarantined and so on. And so, what we're going to be now, dealing with at the health unit, already we know that we've been notified by the Canadian government that there's a couple of individuals that have flown back over the last 14 days. So we're doing contact tracing and isolation and testing and so on. And so I just want to give you a bit of an update of where we are. So to make it clear, we have not had any cases in our area. 2 were found in Ottawa that had come back from Nigeria. And we do know that, again, where this started was in South Africa, and we found it among the areas there. But 13 or 14 countries, including Canada, now have cases. And again, I just underscore the fact that there's 25% vaccinated in South Africa, and 75% of the people are walking around, which are targets for the virus. So that speaks to needing to vaccinate the world and bring up those numbers worldwide, like we have them in our area. I just want to underscore as well that we had 84 cases today. 782 were Delta. Right. And so we're still Delta focused. That's the major threat at this point in time. I'm not putting aside Omicron, but Omicron at this point is under study. We have the precautions in place, but let's keep our eye on the prize. And the prize really is to ensure that we continue our first and second doses, to really vaccinate as many people as we can, 12 to 17-year-olds, adults, and people who need their second dose. Please go get your second dose. We are going to be doing we already started a 3rd dose rollout to ensure that, when the vaccine wears out, we've given a 3rd dose to be able to boost it up. And we're going to be, as you know, 5 to 11-year-olds rolling out vaccine, which is very important, and importantly, maintaining our public health measures, masking, being careful, not overdoing it, and so on. And those are important. Those are vital, not only for our goal here to have a spring that's relatively more normal than we've had in the last spring, but also to protect us optimally against any outside threat like Omicron, which is a virus that can potentially escape immunity and so on. But the higher immune levels we have, the better we'll be able to offset it. One of the things that people ask me about is, well, what happens if this virus or another virus, another mutation, is resistant to vaccines. Well, I know that Moderna and Pfizer, they are ready to go. They can very quickly add a component for a new variant, for example, like Omicron in the vaccine. So again, that's a hypothetical situation, but if it turns out that we need to, we will be able to do that. So that's basically why I wanted to talk about. I wanted to give media and our population here, especially that we're close to Ottawa, that we are also on standby for this Omicron variant. We have our contact tracing in place as required, increased surveillance. We're working with the ministry. We are going to be rolling out the third doses. Stay tuned this week. There'll be some more announcements for that. We're continuing our vaccinations for children. We're continuing to urge people to get vaccinated. And very importantly, be careful particularly with the upcoming holidays. Make sure that you continue with your masking and so on. If you're with other mixed people and you don't know vaccination status, please don't take a chance. So that's it, Jenna. I'd like to open it up to questions.
Thank you, Dr. Paul. Merci. Our first question comes from Hugo Rodriguez, Standard Freeholder. Please go ahead.
Yeah.
Hello, Dr. Paul. Thanks for resuming these. How are you?
Good. Yourself, Hugo?
I'm doing well. Thank you. Two quick questions for you. One, I had asked late last week, and I noticed that you had some of this information in your slides in terms of vaccination of active cases. When can we expect that information?
As soon as possible. As soon as possible. I've asked my staff to look at cumulative numbers so we can have bigger numbers to work with, Hugo. That will starting as soon as possible.
Thank you. And second, just because there was a tiny difference between the Anglais and the French.
Yes.
In English, you said a few. En français, you said 3. So there are 3 folks who are currently being.
Yes, 3. Yes, 3. Yeah.
Omicron. Okay. And any information back from that yet, or is that?
No, we just got it over the weekend. We just got an email saying these are the 3 individuals. That's all we got. So we're following up now.
Okay. Thank you.
Thanks, Hugo.
Next question, Philip Blanchard, Morrisburg Leader. Please go ahead.
Hi, Dr. Paul. So my first question is Lactalis in Ingleside. I've heard there's about 13 people who've tested positive in that facility that work there. Is this transmission within the workers within the facility, or is this people coming in to work sick?
It's we're investigating that, but it's both. We're trying to find the source, but it happened significant transmission within the facility. We've tested everybody, and we're following up. We're in there. We're looking at infection control measures. The majority of the cases were not vaccinated, although some were vaccinated, some breakthroughs. So we are looking at that. And we've also got, like I said in my presentation before, household members of those individuals who now are positive.
Okay. The second question I have is the amount of transmission. We've seen numbers go up, and especially in South Dundas and in Cornwall and that. How much of this has been transmission from within activities like youth sports, that kind of stuff, now that we're into cold weather?
Not that we're tracking that, not much. It's more expected contacts from people, household contacts. That's most of what we've been seeing. There's now a slightly increase in no epilink, but for the vast majority are either outbreak related or like we expected it. Like, for example, a parent was positive and then 3 kids were positive at home, unvaccinated. Those are most of what we're seeing.
Okay. And of the current cases as of today, can you say how many of those are children 11 or under who until recently could not be vaccinated? Do you have a percentage wise?
Well, I could tell you, it was on my slide before.
I might have missed.
There were 14 that were less than 17, and I would say most of them were not vaccinatable.
Okay.
Okay. Including a young baby.
Yes. Okay. Thank you very much, sir.
No problem.
Do those joining by phone have questions? Press star 6 to unmute. Ceux qui se joignent par téléphone ont-ils des questions? Appuyez les touches étoile 6 pour désactiver le mode silencieux. Those are all the questions for today, Dr. Paul.
Okay, thank you very much. Merci.